We're discussing today the state of LTCs and what we have learned in the last 11 months from the COVID lockdown, from our experience with COVID in the LTCs, and what needs to change going forward. And perhaps most importantly, why are we still here? Just before the commercial, Laurie, you were commenting on the British Columbia report, and you suggested there were 21 recommendations. Could you share with us some of these recommendations that were made by the investigators on what can better the LTCs in British Columbia?
Well, there are a number of things like better communication. Nobody seemed to know who was in charge, so those authorities have to be clarified. There was privileged information and funding for authority-operated versus contracted providers. Just a general lack of communication, and no consultation with families prior to making visitation rules on long-term care. So there were just a huge, a wide variety of changes that need to be made. And the government said that they had made those changes, but I think a public conversation would have spurred that a lot more and a lot quicker and more thorough.
And Lisa, I turn to you because, after what Laurie Throness just suggested, that there was lack of communication, there was concern about the residents. I think about the residents' rights and the rights of the family to be with their loved ones. And I suppose the infringement on their rights due to the COVID lockdown, but if they're not even getting the right care, is that even justified? I'm going down a rabbit hole here, but what has been your experience from a legal perspective on what has gone on here with the LTCs?
So our focus right from the spring was on the quality of life that these residents were having in terms of being able to see their loved ones, getting the care that they had been used to from family caregivers, which filled a significant portion of care needs in most long-term care homes, unpaid, but very necessary. They were essential caregivers. So we were hearing stories about how families were being kept apart, loved ones were not able to come in and provide care, which was then not being provided at all in many cases. And there was a deterioration in the residents' quality of life and in their health consequently. So our focus in the summer months was to try and get the government to standardize the essential caregiver designation, get people back into the homes. There were tons of expert reports supporting it. There was really no significant concern in terms of infection protocols. And the government seemed very resistant to do anything from the top down. So the homes had all these loopholes that they were kind of getting around, and essentially nobody was getting in. So through the advocacy of a lot of people, but I think also with our pending lawsuit, which we launched in August, the government did amend its guidelines, not its directives, not the ones that have a force of law, but their guidelines to include essential caregivers. And most homes have cooperated. I know people are still having some trouble, but I think most of the essential caregivers, for the most part, are getting in. It's not perfect.
Now, Lisa, when you said the government, just to clarify, so usually healthcare is a provincial issue. So are you saying government, like federal government, made a blanket statement, or is this on a province by province basis?
Province by province. So we were after the provincial government for failing to put in directives that the long-term care homes had to follow some protocols for getting these essential caregivers back in. They were leaving it to the homes. And so when they did finally clarify things, and there was a lot of miscommunication. I mean, it feels like this is 10 years ago already. Yes. I mean, this year has been so long. But eventually there was a lot of finger pointing and loopholes and so on, but they eventually did sort of clarify. They put it in policy documents rather than in a directive. But I was surprised to see BC is actually still dealing with something very similar to what we had in the summer when I was getting prepared for today. And they are still not getting their essential caregivers in on a consistent basis. It's all, it's home by home and how well you advocate. And that's basically the situation that the essential caregivers are in 11 months down the line. It's really quite appalling.
So, Dr. Lau, I can imagine on a patient perspective, not patient, rather, on the caregiver, the family member who maybe is providing that care, on their perspective of not being able to see their loved one. But in the minute we have before commercial, could you explain to us, what is the psychological impact on the patient, on the resident of the LTC?
Well, a lot of them were confined to their rooms for months, and they didn't understand why their family weren't visiting. The families sometimes couldn't reach people in the homes, even staff, to find out how things were going, let alone speaking to their family members. So there was it's almost like a blackout for periods of time because people had no idea. So you can imagine the the fear and the anxiety the families have. Similarly, patients also, many of them had a really hard time staying in their rooms, especially those with dementia. If you can imagine how challenging that is. That was tremendously difficult.
We're going to continue this discussion, if you may, just when we return from this commercial break. Please stick around.